Hey. Hi, Sal. Hi, Liz.
Hi.
Today we've got Dr. Elizabeth Hamilton with us,
Hello.
who's here to chat with us about, chat with us all about all things girly, menopause, hormones, sex, the whole kit and caboodle from a doctor's perspective as well as from a woman's perspective. And disclaimer is that anything that Liz says is said that is her opinion and is not to be taken as gospel. And you should check everything out with your own GP. Yes?
Yes, that's right.
Excellent. Liz, you and I were having a lovely chat before about hormones and about
Yeah.
the importance of estrogen. Can
Yes.
you just hit me with it? Tell me why estrogen is so important.
So I think we don't realize what you've got till it's gone, isn't it? Right. So as estrogen starts to drop, and it can happen, some people say it can happen as early as like 35. It starts to drop, and you start, um, you know, people start to notice it more with, their periods changing or getting lighter or further and further apart. And that's how you sort of only be classified as the absence of a period for 12 months, you're now in menopause, you're postmenopausal. But I think a lot in the last decade, maybe more, a lot more is coming about the overall effects on the entire body that estrogen has. And I guess we know that, it protects your bones now. Well, I think we've known that for a long time. And that's the estrogen drops, that risk for osteoporosis goes up. But it also is really responsible for, the integrity of our tissues, especially down below. As your estrogen drops, that area, the vaginal, the area where the urethra comes out, it all becomes, can become drier, and the integrity there really kind of starts to drop. And some women can get really uncomfortable there. So they just notice that with a bit of
So,
replenishment.
Liz,
Yes.
sorry, I was actually reading the other day about low-level urinary tract infections and that being associated with low estrogen. Is that another thing that's sort of coming out at the moment?
That was in my training. Like, as in, we as your estrogen drops, your risk of UTIs goes up. And I guess there's also other genetic factors that play. But for some women, if that genetics are against them, they start to get more UTIs. And sometimes a little bit of estrogen cream actually helps decrease the frequency of UTIs. There's other things they need to do as well.
Which is weird, right? Because you just don't associate the two straight off the bat.
But yes, it does keep the area moist and more supple, I guess, estrogen. It really helps with the way that the mucous membranes there work and work to, so I'm getting a message, and work to really keep that area healthy.
Yeah. So, and Liz, you were talking before about like you had a person come in who was feeling quite depressed as well.
Yeah, so
And
rates of,
after a bit of an estrogen boost.
yes. Oh, I think that is a very common thing that is getting understood more and more in the last 5-10 years, again, maybe more. But in the past, when people were going through depression, you thought about, psychology, antidepressants, and lifestyle changes. But now when you're looking at a woman, at a female, even after the age of 35, sometimes we've been now getting trained to question, well, is this an estrogen, deficiency? Is this perimenopause? And so now increasingly, a lot of GPs with women in this age group with certain symptoms and how they're feeling, you give them, it's not called hormone replacement therapy anymore, it's called MRT, menopause replacement therapy. You give them a little bit of
Interesting.
you give them estrogen. So you give them estrogen, progesterone. It's all dependent on whether they've got a uterus or not. But you give them this estrogen, and this woman came back like 2, 3, 4 weeks later, a changed person. She was thinking straight. Her depression settled down. She just felt so much better, and she's just now she's loving it. She's just on menopause replacement therapy now.
Yeah.
And I guess
Brilliant.
that makes sense because in my mum's day, we were talking about this. Every second person was on an antidepressant. Like they weren't testing their hormone levels. They were just doling out antidepressants, because there was a psychological fix of hormone dropping.
Well, the thing is, it's funny. Like when you are testing for hormones, at least my understanding is The hormones themselves won't tell you if you're perimenopausal. They only tell you once you've gone through menopause, right? Because if you're perimenopause and you're still
Is
somewhere
that
in
because
your
of the
cycle,
fluctuators?
yeah, you're somewhere in your cycle still in the perimenopause, right? But they might be further and further apart, but you're still in the phases. It's only once you're no longer ovulating, full stop, and you have no periods for at least a year, you go, okay, well, maybe, yeah, you've definitely gone out of your cycling. So now let's test your bloods and see, has your estrogen dropped?
Right.
So it's really hard to tell. It's in like, you're going to have to like chat to an endocrinologist about this, but it's really hard to tell when a woman is perimenopausal purely because of hormones, right? It's more a clinical diagnosis. Like you chat to the woman, what are you experiencing? What are you feeling? Sounds like you're going through
Wow.
and you might also do other tests, like you got to rule out thyroid problems because an unactive thyroid, can give you depression too. You have to rule out some other organic causes, but you have to wear a good history. Spending the time with a GP that you're comfortable with is really important because only through this talking can you actually really go, oh, well, libido's low, your vagina's dry, you're not just depressed, right? You've got other things going on. Maybe this is more perimenopause than purely depression. Does that make sense?
That's a really good point. And a good segue too into the thanks, Liz. Yes, it does make sense. Into the whole you mentioned there, your libido, right? And we talk a lot about sex because we've kind of come into the point, Liz, you've got young children yourself, so you're still at that point where you're bloody exhausted all the time.
All the time.
And we're exhausted all the time. But we did talk about the importance of sexual wellness and feeling sexual and stimulation, etc., which is why, of course, we're making Cleo to kind of kickstart things again for women who might have been feeling a little lacking in that area. So. And we talked about the importance of sex. So, why is it so bloody important, Liz, from your perspective?
Sex. Well, nature's created us to orgasm, right? That's not a man-made thing. It's a very natural thing. It's a very fun thing. Nature's made us orgasm so that we want to have sex and reproduce, right? And continue having young. So it has to make us feel good because if it didn't, we wouldn't have children, right? So we wouldn't want to have sex. We wouldn't want to procreate. So now we're really, and that orgasming without necessarily having to have sex, masturbation and all that, that's not a new thing. That's been going on for thousands of years, right? So it's a way for us to feel good about ourselves. I think obviously with society and societal norms, it's a taboo topic and people don't want to talk about it. I think that's changing now. And I think it's really important because in the way that
It
I
is for
see it,
us.
it's great. It's great. I think it's so important to talk about it more. Have the number of women I see come through who have gone through menopause, husband wants to keep having sex with them, they've got no libido, and it's not just in women with kids. It's throughout the lifespan, and it's not even women. There's women in their 20s with libido too. It can be that is not so much on how the woman is feeling and making them feel as good as possible. It's about getting the job done. And so I think there's a lot on, I had some sexual counseling courses where you go, how do we do it in a way that the woman can feel great and enjoy it and not have to do it as a means to an end? And, and it's very different. Like people go, oh, well, is that non-consensual sex or whatever? I said, no, it's different. Like you talk to mum that people truly love their partners, they're in great relationships, but one's got higher libido than the other, and that can cause, it's not even fighting, but it can cause a little bit of even sadness between them because they're not on that same page. So I think it's a matter of understanding how much what really drives the woman, because stereotypes exist for a reason, and stereotypically men can really just have fun and enjoy themselves anytime. It's a lot easier for them to become aroused. But I think for women, it's different. And I don't think I've come up with this theory. I'm not the only one. My theory is you can't have both sexes highly sexually driven, right? Because we would never get anything done, right? You can't have women highly sexually driven and men highly sexually because we would not do anything, right? We'd abandon our young, we wouldn't protect them, right? Conversely, you can't have both sexes not wanting to have sex because our species would die off, right? So somewhere one has to have a higher sex drive and someone else has to go, no, because we have to be productive, right? So I think it's natural.
Yeah. We've got to eat.
Don't you think?
Let me pluck those berries.
Like, I think maybe nature has.
Oh, I love it. I love it.
Yeah.
It makes sense. It makes sense.
Yeah. So if you want a woman,
It's so true. But I wonder,
Anyway, I think I'm rambling now. What I'm saying is what drives us is very different. And it actually naturally, it has to be different, right? Because you can't have us both randy, right? So to really understand the woman's psyche, what drives her and what makes her feel good and you want to have a great sex life, it has to be very different to a male, right?
Yeah. Yep. Absolutely. But also, you know what? And we're just gonna check because I'm near a girls' school right now. But we also, girls have a clitoris, right? And the things that we can do with that clitoris are quite amazing. That men have, I don't know whether they truly, well, how would they ever understand the clitoris?
We didn't get taught, and men didn't get taught. Do you know what I mean?
Absolutely.
And the feeling, obviously, no one can feel what you're feeling, right? So that the nuances and the angles and the
This is
pace
true.
and that, it's
The
so
angles.
personal.
Yes. Yes. Actually, Sal and I were just talking about that before because we're talking about our patterns on Cleo and how important they are. And, me, I'm like, that's it, I'm fine. Whereas Sal's going, well,
No,
I think I just need
I'm
to
very pattern specific. I like.
You like variety.
And I'm like, no, I'm not just a like get to the point girl.
Yeah.
Yeah.
I like to.
Yeah, you like to go around the houses, which is great.
I do.
Depending on how I feel. Like some people might be, well, like, let's go now. And at the same time, a week later, that same person might be like, no, actually, I don't feel like that right now. It could be like, mood dependent. Like, it just, I want to take it slow.
Exactly.
Quick.
Whereas
I get tired, I just want to go down quick.
Sam's only got one pace.
Kind of do. Yeah,
I
do
agree,
actually.
Liz. I like the nuance, the individuality, and the fact that, as we said, you're not married to this thing. You can have a bit of variety.
Yeah, exactly. And you can direct it. Press that button, turn that button off. Yeah, throw it away.
Spice it up. Actually, you have
toss
to.
it.
Exactly.
Variety is the spice of life. Excellent. Well, okay, Liz, thank you so much for being on the. And we're going to revisit. We're going to revisit you again because this works beautifully. And that was just literally 15 minutes of.
And you're so
wisdom.
busy. Yeah, you're so busy.
We really
appreciate your time. And we can grab you for 15 minutes, whereas we can't get you for hours on end. Unless there's wine.
Excellent.
I love this.
Thank you. Thanks, Liz. Thank you. Yep, we're doing our best. Thank you. Wonderful. And we shall say ciao for now.
Ciao for now.